Your needs. Think service, think your needs. Welcome to the emergency department. What do? Saving lives, SaaS or cloud tech, all in one platform, data security, real-time appointments and payments, AI automation, digital records, analytics, multi-platform apps, resource and inventory management. A patient goes to the emergency department. You can either select the patient and click on Add or double-click on the patient, do patient lookup. And if the patient details are not already present, you can fill in the details and then click on Save or Save and Admit. If the patient details are already present, when you do patient lookup and enter the phone number and click on Search Patient, the details of the patient gets populated. You can then select the patient and then click on Save and Admit and then Consult. First, we enter the patient brief. Select the date and time of arrival, the mode of admission from walking, wheelchair, stretcher, ambulance and other modes. For now, we enter wheelchair. Triage property from immediate, urgent, non-urgent to expectant. Now we select urgent. Then go to patient belongings section and select the options from yes or no as per the patient details. If you select yes, you can enter in further details. Once you are done with the patient belongings section, then you can enter the reason for arrival, the doctor to whom the patient case is informed, the doctor who is performing the consultation. And once you enter in these details, the next section is the chief complaints. Fill in the symptoms. For now, we enter chest pain. You can enter in the onset date, the severity of the emergency case, the description of the complaint, and other notes. And once you are done entering these details, the next section will be the level of consciousness. Select from the different options that are available. Then from the pain assessment scale, you can select the different options where the color grading is also present. You can select if the patient is pregnant and then fill in the details like months, last meal time, solid, and so on. Next, patient intubation, where you select the date and time, the type and the indication. Then decubitus ulcer, enter the condition of the wound if yes. The psychological status of the patient, including the additional observations, are entered. Then other details like social history can be selected from yes or no, and if yes, you can enter in further details. Once you are done with this, click on Save and Next. Then enter in the medical history, including allergies, previous illnesses, chronic conditions, surgical history, family medical history, menstrual history, and obstetric history. You can add new details, edit the details, or delete the details as shown in the video. Next, we perform medicine reconciliation. You can select the source of the medication list, the disposition of the medications, and add the different records of the different medication and fill in the details like the medication name, dosage, type, route, last dose taken, notes, and then save, delete, or edit. Once you are done with this, you can simply enter in remarks if required and then click on Save and Next. Next, we enter the vital signs. You can add the vital signs for different dates and different times to monitor the patient condition. You can add multiple records, add or delete them, and save them. And once you are done filling in the details, it can be shown in the graphical format as you can see in the video. This gives a comprehensive view of the condition of the patient, about the improvement or depreciation. Next, we move on to assessments. Enter the MLC number, the assessment done by, date and time of assessment, orientation to patient environment. Then you can perform assessments like the GCS scale, Glasgow Coma scale. Enter in the eye response, verbal response, and motor response from the scale given. Then do ABC assessment. Select from the options available. First is airway, then is breathing, next is circulation. Once the options are selected and the details are filled, the next assessment is the pickle assessment. If you select present, then you can enter the location and the condition. Next, a special feature that we have is to select the injury site directly from the UI as shown. And when you select, you can enter the injury type, severity, notes, and so on. You can edit or delete and save them too. This is for the front side. The same thing can be performed for the back side too. All you have to do is select the patient part, which is affected. Once you are done filling in these details, you can edit or delete them as shown above. Then do additional checks if yes, enter in the details, add additional notes if required. And once you are done filling in all these details, you can add provisional diagnosis as shown and then click on the Save button. The details are saved. You can edit or you can reload. Next, we do investigation and reports. Under investigation, you can select the tests that are already present through the search button, or you can add new tests in the other tests section. This is for pathology section. You can do the same thing for radiology section, and once you are done, you can simply save. After performing and selecting the tests, you can click on Save. Once it is saved, you can then generate the indent. When you generate the indent, it means that the tests will be done without the payment. The payment can be done all at once. You can see this under the billing section as shown. If you go to indent bills, you can see the radiology and pathology section. Next, the lab assistant will take the samples by going to the patient, clicking on the details and going to the ED department. As you can see, the tests that are prescribed are mentioned. The samples are collected. By clicking on Collect Sample, you can see that the details are populated. Click on Add. Now you can enter in the test results after performing the tests. As you can see, we are entering the test results for complete blood count. Once all the details are entered, then you can close it. You can do the same for all the tests that are prescribed, or you can add new tests. And once all these details are entered, click on Verified and Save. Once you click on Verified and Save, the status of the test changes to Reported. You can do the same for the other test, which is the chest X-ray. You can change the template as you wish. You can upload images. You can change the size of the image by just dragging, as shown in the video, and then click on Verified and Save. The status changes to Reported. These reports can be printed and sent through WhatsApp or email and so on. You can also generate multi-page reports, or you can even upload your own attachments or reports. Next, the status of the test is changed from indent to handed off by clicking on Status. And then there are different status like raised, rejected, in progress. We select handed off. We select the person to whom it is handed off to and then save. Then the status gets changed once the receipt is generated. It is done for both the tests. And once the status change is complete and changed to handed off, you can see that the status has now changed from ordered to handed off. Now we go back to the ED department and we go to the treatment plan. Now the treatment plan is currently empty, but if you click on the diagnosis and click on predict, all the details get populated as shown. And they are shown in the form of episodes. Now we enter the consulting doctor, the assigned nurse if required, and then click on save. This is the first treatment plan which comes under episode 1. We can also add another treatment by clicking on Add Treatment, or you can even edit the treatment plan. Now we added a new treatment. You can populate the details from the previous treatment. Now we do adding the new diagnosis, adding the medicines. This is a new treatment plan where we add the medicines, add in the advice. The medicine availability is also shown. Enter the consulting doctor and the assigned nurse and then click on Save. Once you save, you can generate the medicines indent as shown. Now we click on the Save button. Once it is saved, you can generate the indent. Scroll down and then click on Generate Indent under Medicine section. The indent gets generated. The same thing can be done for the different episodes. This indent can be viewed under the Billing section. We click on Generate Indent for all the episodes as shown. Then if you go to Billing and then go to Indent Bills, you can see that it is displayed. Next we go to the pharmacy where the patient medicines are collected. As you can see, the invoice is shown. Now if you click on Change Status to Handed Off, it denotes that the medicines have been collected and the indent is generated but the bill hasn't been paid. So the status is changed to Handed Off. Once the indent status is updated, then you can go back to the patient details and then perform the handover and discharge. Add the referral record, add the records of the materials preserved as shown in the video, perform the handovers by entering in the refer to specialist, consult doctor, if discharged, whom to be followed up with, if transferred, what are the location, the date and time, the doctor with whom it is checked, the phone number, whether the bed is available, and so on. Fill in all these details and then move to history and physical or ER details where you enter the diagnosis, treatment, procedures, investigation findings, and the treatment to be continued. Once all these details are entered, then we can also perform handoff as shown. Here we have to enter details like ER physician name, date and time, handoff nurse, receiving nurse, if Dharma local authorities are informed. All these details, if yes, we have to enter in the details, and then once all these details are entered, simply click on the Save button. Next is the discharge summary. Here the details that were previously entered are already populated. Then you have to just choose if the patient is discharged against the medical advice, the date and time of discharge. The vital signs, as you can see, is already populated. Scroll down, the complaints, the clinical findings, all of this is already populated from previous content. Next, add in advice, patient's condition and follow-up care instructions. Add in the medicines that have to be taken after discharge. Then enter in the doctor name and then click on Save or Save and Print as per the necessity. We click on Save and then we go back. And then when you click on Print, you can see the discharge summary. This is how the summary tab looks like. You can see it in the form of episodes. Thank you. you for patiently listening.